Hello, this is Dr Helen and Marianne. Welcome to our GenderGP podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself, and our head of therapies. So welcome everybody to our podcast. I'm here with Marianne, as usual, and today we're really excited to welcome Dr Bellinga from the FacialTeam in Marbella. Dr Bellinga, thank you for joining us. I'm going to let you come in and just tell us who you are, what you do, what your lovely and amazing team do. So I shall hand it over to you.
All right. Good morning to everyone. Thank you so much for your kind words. Let me introduce myself. I'm Dr Bellinga, Raul Jimenez Bellinga from FacialTeam, Spain. We are placed in Marbella, in the south of Spain, lovely Costa del Sol. And I'm part of a surgical group who is named FacialTeam. FacialTeam is a surgical group which started in 2008, and we are just dedicated to facial feminization surgery. So we are pretty experienced about what we are doing now. At FacialTeam, we are now 6 surgeons, and we are all dedicated to one very specific feature in the face. Like in my case, for instance, I'm the one who is dedicated 100% to rhinoplasty, to feminization rhinoplasty, which is, let's say, slightly different to a cosmetic rhinoplasty.
Okay, wow, brilliant. So the rhinoplasty being the surgery on the nose, the feminization of the nose. So just broadly, you've got 6 surgeons. Do you all do something different, or how does it work if someone needs a little bit of attention on their nose as well as their forehead, or how does it work to get that whole kind of picture?
All right, good. As I told you at the beginning, we are expert in one very specific feature in the face. For instance, as I told you, I'm the one who does the nose, but Dr. Capitan is the one who leads, let's say, the forehead surgery and the anal surgery. Dr. Simon is the one who leads the jaw and chin surgery. And so, of course, when we make the surgery, when we are in the operation, we are not all together. This is not like a party, you know. So first, we have to do steps. The first steps, we start operating in the Adam's apple, then we go to the jaw and the chin surgery, then we go to the forehead surgery, and I'm always the last guy. I'm the one who does the rhinoplasty at the end of the procedure. You know, basically because the nose is a very important feature, and it has to match and fit in regard the new changes we have done in the other features, basically the forehead and the chin.
It's amazing, you know, to think what you can achieve. So how did it all start? How come we've got 6 surgeons working in Marbella, in the beautiful Costa del Sol?
That's a very interesting question. You know, it's a lovely story. You know, at the very beginning, the founders are actually Dr. Capitan and Dr. Simon. They met each other a long time ago, and they started to build this group, the FacialTeam. Then a bit later, 1 or 2 years later, joined the team, Dr. Bailon. And then they were only 3 surgeons performing this type of procedure. It was, you know, only one surgery, 1 case, 1 patient every month, let's say. A few years later, in 2013, I joined the FacialTeam. By the way, I was working and living in Brussels, in Belgium, making a fellowship in facial cosmetic surgery. And then I joined the FacialTeam just as a kind of, rhinoplasty expert on the team. And this is kind of a snowball. So we were growing up. And because of the amount of procedures and amount of patients that came to Marbella, we need to include more surgeons in the group just to hold and to assist our procedures, because it's nowadays we are very, very busy. In some cases, we perform up to 7-8 surgeries. So we operate 7 to 8 patients every week.
Wow. Just as a broad question, how different is it working on facial feminization surgery as to other facial cosmetics surgeries that
that's a very interesting question, a bit tricky, you know. And but basically, cosmetic surgery is about how to improve your appearance. That's it, you know. Facial feminization surgery is just about getting rid of the masculine features, basically removing all the features that testosterone caused during your puberty. So that's completely different, Of course, as a very nice side effect, we can obtain some degree of beautification or even rejuvenation, but that's not the main goal. The main goal is to look as feminine as possible. I like to say your twin sister's face, the most feminine version of you. And this is very important, because we must keep your core identity. This is not about removing your face and putting a Barbie doll's face. I like to say, okay, if you're looking for that, we are not your guys, because we don't like that. That's not our philosophy, I want you to recognize yourself in a mirror, your family, your friends, everyone, So this is about removing those masculine features. And this is very important, because I always like to say as well, surgery is not a need. What we do is not a need at all. Surgery should be taken just as a boost of confidence for you. Hairstyle, the way you dress, the way you move, the way you act, the way you talk, that's 99.5% of everything, of all this transitioning process. Hormonal treatment makes big difference. That's always for good. Surgery is kind of the cherry on the cake, the frosting of the cake. That's it. It's just a boost of confidence for you. This is not a need. And it sounds weird from my mouth, because I'm surgeon. This is my job. Actually, this is my passion, But I try to be honest and realistic. And this is the truth,
That's so nice to hear, I have to say, because I do think some people go into surgery thinking it's going to make them somebody different, and actually,
but actually that's also some kind of mistake. Some patients think we have kind of magic wand in our hands, and this is kind of magic, and suddenly you will look like a princess. You must work on that as well. So we can give you some little extra. As I told, the cherry on the cake. But you must be first of all the cake. You understand what I mean? It's a big mistake to put too much weight just on surgery. That's in short.
So what does testosterone do to a face during puberty? What are the key kind of features that happen from testosterone?
Okay, basically the effect of testosterone causes some extra growing of bone and cartilage. So let's say, specifically talking, the frontal bone, when we say the forehead, is very affected by testosterone, because in male, we can see this frontal bossing area, this very strong supraorbital ridge, giving this kind of, let's say, aggressive look, the eyes look slightly deep set, That's a very typical masculine feature, And that's one of the main reasons the forehead surgery is key, or is one of the star procedures in facial feminization surgery, Basically because we are changing as well the frame of the eyes. We are changing the expression of the eyes, and this is crucial. This is very, very important. Talking about the nose, there is some extra growing of the cartilage. So on average, a masculine nose is slightly bigger, wider, longer, Talking about the jawline, the same. Male jawlines are slightly more square, wider, bigger, and as well happens with the Adam's apple. Most of people think the Adam's apple is a unique structure in male, and this is not true. Everybody, male and female, have an Adam's apple, but also because of the effect of testosterone in masculine patients, we develop a kind of extra growing. It's kind of like a peak of the iceberg, let's say. But everybody, male and female, have an Adam's apple, and this is something very important, because you may find millions of cis women with a prominent Adam's apple, as well with a prominent and a square jaw, with big nose, and they look very feminine as well. So we have to keep in mind all those things as well. I like to say my wife has a slight bossing on the forehead, a big nose, a wide jawline. It looks pretty and very feminine, It's lovely. So this is sometimes as well something, taste related as well. For instance, I like to say, okay, I love square jawlines for a woman. I love it. Angelina Jolie, Sophia Loren, they are even icons of beauty. But okay, following the anthropometric measurements here in the Western society, okay, we may say, okay, it would be great to have a more oval shape, a bit narrower. Okay, so this is something we have to put in the balance, because sometimes it's not only about facial feminization, but it's also about cosmetic and taste. So in short, there is no wrong answer about this.
So you talked then, I'm just going to just recap what you said, just in case people don't understand the accent quite as well as I have. But so basically you're saying that testosterone makes the bones grow a bit more. So the forehead can be bigger, which means the eyes are kind of more set back. The jaw is maybe more angular and square, and the nose maybe wider, longer, with a bigger added back, that kind of thing.
Correct. And that's one of the main reasons when we are talking about facial feminization surgery, we are talking just about the structure. We are talking about the bone. Basically, all these procedures are about working or removing the excess of bone and or cartilage in these cases, like in the forehead, like in the nose, in the jawline, or also the Adam's apple, which is basically cartilage, So, and that's one of the main differences with cosmetic surgery. When everybody thinks about cosmetic surgery, we're talking about facelifts or eyelid surgery, whatever. That's about soft tissue. When we are talking about facial gender confirmation or facial feminization, hormonal treatment makes a big difference in the soft tissues, what we call the secondary aspects, the fat distribution in the face, the skin quality, also maybe some, if you're doing some laser or electrolysis, you are eliminating the facial hair that will make the skin look slightly thinner, more elegant, more delicate, That's about the secondary aspects. That's about the envelope. That's about the soft tissue.
Yeah.
But hormones and those procedures do not change the facial structure, the facial bone, the skull itself. The only way to deal with that is by surgery, unfortunately. That's the reason. Yeah. And that's what facial feminization is about. Removing, changing the skull, changing the bone, remodeling the bone.
So can people get an idea of like a before and after idea before they commit to surgery? So you would have a look at their face. How can you kind of show them what changes you might be able to achieve with surgery?
When we evaluate a person, when we evaluate a face, it's very important to follow, as I told a few seconds ago, the anthropometric measurements. We have to focus on the upper third of the face, the middle third of the face, the lower third of the face. And very, very important, we must listen very carefully to the patient autoanalysis, let's say. For some patients, they are very worried about the nose, or they are very, very worried about the Adam's apple. But we as surgeons try to give a very objective point of view, a very objective and very realistic, which is very important, very realistic evaluation of the facial features. So we try to be very strict and very objective, as I said. And we try to give a very, very realistic evaluation, feature by feature, talking about the hairline, talking about the forehead. So we give our opinion as experts. And then this opinion may be different from your own expectation, from your own self-analysis, let's say. And maybe you don't agree with what we say, our analysis. But as I told at the beginning, there is no wrong answer here. If the nose is the only thing that really bothers you, do the nose. If the chin is the only thing that bothers you, do the chin. If the forehead is the only thing, do the forehead. I mean, there is no wrong answer here. It should be taken, as I said, as a boost of confidence. That's it. Of course, when we give our personal opinion, our analysis, we try to be very detailed, and we are experts, so we can detect very easily the masculine features. We explain about that, we talk about that, but then the final decision, of course, is yours. It's from the patient decide. And so in case of doubt, I like to say, do nothing. That's my best advice, because as I said, this is not a need at all.
I was just going to ask, when we spoke about testosterone and the damage that it causes trans women, and you started at the top and then you kind of worked down. When you said about the surgery, I think it doesn't necessarily work in that direction. Is there a starting point for feminization that you would say, rather than commit to something and not be sure, but actually would just sorting the brow out make a big difference?
Yeah. When we meet a person the very first time, it's very instinctive, because we can say what we can recognize, male or female. How? Just looking at the eyes. So in the way we look is basically what we can recognize the gender of that person. So it means if we can modify the way you look, we can modify as well that gender perception. And that's one of the main reasons the forehead, when I say the forehead, basically I'm talking about the ridge on top of the eyes, is so important in facial feminization because it can change completely the way you look. So it changes the perception about your gender, and also that's a reason the nose is also so important, because we are modifying the frame around the eyes, So in most of cases, it's true that, I would say in 90% of patients that have a consultation with a facial team, most of them, we recommend to do the forehead because it's a very predictable procedure, extremely safe procedure, and for sure is the one that feminizes the most of face. There is no doubt about that. Now there are many scientific articles proving that, and that's one of the main reasons we are very, very focused on working on the forehead as well.
You talked about scientific articles there. I know that your team have done a lot of good for research, haven't you? I mean, when we were talking the other night, Dr. Capitan was telling me that, basically when you started this kind of work, there was no rule book, there was no guide, there was no open up the surgical anatomy book and this is how you do it. You really felt the way and led the way, I've come to understand in this, And I think we in the medical world, we're still battered every day with people saying there's not enough research, this is not tried and tested and what have you. And I want to congratulate you for the work that you've done on forwarding research in this area so that other surgical centres can follow your example. So I just wanted to say well done on that. It's
nice because now this morning I have received a message because the Plastic and Reconstructive Surgery Journal has accepted a new article done by the facial team. So that's good. And this is very important because, most of surgeons that perform facial feminization surgery, they still think, okay, this is kind of, artistic work. Uh-huh. It shouldn't be taken like that. This is pure science. We are doctors and this is surgery. We are surgeons. So this should be taken just as pure science. Everything should be completely protocolized. And we strongly believe on those protocols. So we try to evolve this field, so we try to publish all these protocols and the way we think it should be done, because it's, at the very beginning, the father of the facial feminization, who is Douglas Austerhout, published the first scientific paper in 1987. And for almost 20 years, there was a long gap in the medical literature with no mention to facial feminization surgery for 20 years. So of course we started, gradually, but nowadays we have published quite a lot, a nice number of scientific articles about facial feminization, and we try just to improve, this growing field. That's it.
I know that people listening, there's going to be a few very, very burning questions, and I'm just going to throw them at you. I want to know, we want to know, does it hurt? How long does it take to get better? How much does it cost? Will I have scars? Is it obvious? Just take us through those kind of very, very basic...
The technical things, okay. That's good. That's fair. So one of the main goals of FFS, of course, the first one is to look as feminine as possible. Second one, in an extremely safe way. And of course, and this kind of threefold, because we must use invisible approaches, because it has no sense to change a feature into a visible scar. No. It's nonsense, So everybody can point and look at you and say, okay, look, she has that scar, that means she's trans. Yeah. That's not the goal. The goal is to bend in society, to become invisible, okay? So, if, for example, when we work in the jawline to make some recontouring in the jaw, in the chin itself, we always use what is called intraoral approach. So all the small incisions we perform are inside the mouth, so it's not visible. When we operate on the Adam's apple and the trachea safe, it has no sense, and we still see that in many cases. Many patients operated elsewhere, they place the incision just on top of the Adam's apple. It has no sense, because then we are changing that feature into a very visible scar. It should be done just below the chin, in the mandibular plane, because when you're facing a person, nobody can see that scar. When we work in the forehead, and this is very controversial because it's a kind of hot topic in congresses, and so Nowadays, most of surgeons perform what is called the hairline approach. Hairline approach means when they make an incision just in the hairline itself to work in the forehead, and simultaneously they try to advance, they try to pull down the scalp to lower the gap in between the eyebrows or the nose to the hairline. We do not agree with that, basically because it may leave you a quite visible scar here, so you won't be able to pull your head back. And also by doing that, it sounds good, but it doesn't work because it cannot close the temples and to create a natural and round hairline. The way we do that is by using a coronal approach. It means we do the incision just on top of the head, completely hidden by your own hair, so it's not visible. And the best way to correct the temples is by hair transplant, for bad and for good. For good because this is extremely predictable, long-lasting, and natural with no visible scar, which is very important, as I told you. But on the other hand, I do understand it may be expensive.
Yeah.
To be honest. When I perform the rhinoplasty, in every single case, I perform what is called the open approach rhinoplasty. Rhinoplasty, there are, let's say, two main ways to do that: closed approach, open approach. The one we use at FacialTeam is the open approach rhinoplasty. It means we have to make a very short and small incision in between both nostrils. Okay, that scar in few weeks it becomes almost invisible, and in 1 year time nobody will be able to see anything at all. So it's not a concern for any patient about that. So invisible approaches or non-visible approaches are crucial in facial feminization surgery. Nowadays, some surgeons still perform external approaches, external incisions to perform your surgery. It has no sense. It's nonsense.
Yeah. That's amazing. I mean, you've taught me so much there. And I'm just going to recap again in my kind of language. So basically what you're saying is that anyone who needs some jaw reshaping, don't cut under the jaw where you're going to see a big scar.
Please.
Go in through the mouth, inside the mouth to get to the jaw.
That's it.
And for the Adam's apple, instead of making a cut on the Adam's apple, go higher up, like under the palate, under your tongue.
That's it. Correct.
And for the forehead, instead of making an incision at the top of the forehead where the hair starts, go further up into the hairline so you can get down to the forehead from there.
I understand, technically talking, doing that approach much higher, it's a bit more, tricky for most of surgeons, but as I said, okay, we do it up to 7-8 times every week.
Yeah.
So it's our day by day, actually.
You started talking by saying that that's controversial as well. What's controversial about that? Would other surgeons not use that?
Because most of surgeons, they still think or believe that hairline approach is the best way to correct the hairline. And as I said, okay, in most of congresses and conferences, they don't even show the scar. They put the fringe like this, okay, they put a nice hairstyle, hiding the incision, hiding the scar, because actually it doesn't work so well. As I said, the best and the only way to correct properly the hairline is by hair transplant. Unfortunately, because doing that technique is much more easy. And that's the thing, most of surgeons, they still prefer to use the hairline approach because technically talking is much easier. You don't need to be really an expert about that, So expertise is crucial, is key here.
And the other two things I know people are going to want to ask is how much does it cost? I know it's going to be individual, but a rough kind of feeling. And also, how long does it take to get better? How long is the bruising and the bandages and everything like that?
I will start talking about that. And then I'll for the last one, okay? This is big surgery, actually.
Yeah.
It's, thank God, it's a very safe and very predictable, the way we do it, but of course it's surgery. It's not like going to the hairdresser. So it means there is a recovery time. Of course, the more procedures we do, the longer that recovery. That's common sense, But let's say if a patient performs, let's say, basically all these procedures from top to bottom, like the forehead, the nose, jawline, ensemble, whatever, they only had to stay at the hospital for 2 nights. After those 2 nights, they can leave the hospital, but of course they have to stay around the hospital in the city. And 8 days after, we remove the sutures, we check everything is fine, and then you are ready to take a flight back to your place. 99% of our patients come from abroad.
Yeah.
So let's say, in short, since the patient arrived at Marbella until the patient, she takes a flight back to her base, she has to stay with us about 12 days, let's say 2 weeks in short, okay? In 2 weeks' time, that patient can do, let's say, normal social life, okay? Of course, that's not the final result. There are still some swelling, maybe still some bruises, but okay, be very easily covered with some makeup. That patient can go for a walk with some friends, take a coffee with the family. Nobody will look at her twice, in the street. She knows she's swollen. I know she's swollen. We know that's not the result. But for the rest of people, nobody will take care about that. Nobody will know what the hell happened there, So it's they don't look like a monster, not even in 2 weeks' time, right?
Wow.
So to start normal activities, like it depends on the job, let's say, but in 3 weeks' time, the patient can start to do, let's say, regular normal things, working on the computer, as I said, going out with friends, family, working properly. If the patient like to work out, to do some exercise, we have to wait a bit longer, up to 6 weeks. In 6 weeks, let's say, in 6 weeks' time, and the bones are completely healed and fused. Even you can do boxing, okay? Nothing, well, if you do boxing, something may happen, yes, of course. But, there is no need to wear a helmet for the rest of your life. Let's say in 6 weeks' time, everything's healed, let's say. But of course, that's not the final result. We like to say you have to wait a long time to see the final result. Even a bit longer than 1 year. It doesn't mean that during that year you will look swollen, bruised. It's not like that. But to see the final detail, the final millimeter, we have to wait a bit longer, a bit more than 1 year, let's say. Okay. But in short, let's say in 2 weeks' time, you look fine. So it means once you're at home, you look okay, you're fine. Okay. In 1 more week, you can do normal activities. In 3 more weeks, you can do a sport, and that's it. Is it painful? Sorry. Is that surgery painful? Well, it's not painful itself. You will feel at the very beginning discomfort because of the swelling, because of the pressure of that swelling. It's very important to know as well, the first days or even the first weeks after the surgery, that patient will experience a very strong numbness sensation in the forehead or in the jawline, basically because of the compression of some nerves that give sensation to those areas, okay? But day after day and week after week, you will recover that sensation. But on the other hand, that helps to diminish that pain. Of course, we always provide a lot of painkillers, anti-inflammatory treatment, antibiotic, but it's not painful itself. Talking about money, I know because this is this is a hot topic here. Yeah. Honestly talking, I cannot tell you very precisely, but it depends, of course, on the amount of procedures you do. But it can be in the range from, let's say, 6,000 euros up to, let's say, 25,000-30,000 euro. It depends. Of course, if you include hair transplant it's expensive. But that's basically the range. If you're doing just a rhinoplasty, it's very cheap. It's not cheap.
Yeah.
Because this is surgery. Unfortunately, most of governments still do not cover these procedures. But I don't know how it works there in the UK but here in Spain, the sex reassignment is completely covered. That's good. Of course, hormonal treatment is covered by the national health system, like in the UK as well. Yeah. And also the Adam's apple surgery, okay? And that's one of the main things, because when we see patients with that operation done in the health system, the national health system, we see those horrible scars here. And that's one of the main things we don't like, See the scar here. I guess in France and also in Denmark, I think it's partially covered by the health system. The forehead, the rhinoplasty, the jawline, and also in the Netherlands. But this is something we have to evolve as a society, But nowadays, facial feminization surgery is not covered, unfortunately, by governments. No country.
So do you do any payment plans or anything like that? Any staged payments, or is there anything that, because it's kind of thing that, I mean, of course, having any type of surgery isn't needed to validate somebody's gender. You know, someone is the gender that they are, whatever that looks back
Actually,
in the
this is a need. This is a need.
So like you said, it was, and the other things that trans women, the femininity of a trans woman is about so much more than just that facial appearance. Like you said, it's the icing on the cake, but obviously it comes at an expense. So are there any ways of softening that blow, you know, in terms of payment plans or anything like that? Or is it something that you've got to save up for?
I don't know exactly, you know, the way we do it, because it's a different department, you know, at the facial team. But I know there are some kind of, you know, possibilities to make everything, you know, a bit softer, let's say, for the patients. And also we are working, we are trying to make any kind of, how do you say that in English? It's, you know, kind of social work for community. And this is something we are developing and we are working on it. Okay, but in some specific cases we can offer this, let's say, for free. In some specific cases, you know, that's a kind of let's say social work. Let's say, for people, for patients who has no possibilities at all. It's a foundation.
You know? Excellent. Can I just ask, are there any psychological assessments before people can access surgery?
Actually, there is no need. We also have a psychologist at the facial team unit, you know. But just if the patient demands or asks something, okay, we can offer that, you know, that possibility. But there is no need to bring, let's say, any kind of, you know, paper or document just to do anything. I mean, that's it. That's it. Of course, before any surgery, we have a meeting, an appointment, a consultation, a proper consultation, and we can solve any doubt, any question. You can meet also, you know, the psychologist. Well, actually, anyway, you will meet the psychologist because we work all as a group. You know, we offer all this, not treatment, I mean, but all these possibilities to every patient, just to make you feel more comfortable and more confident with your choice. With you know, what you're doing here.
I remember that quite a few years ago, we had a patient who wanted to have some nose surgery done here in the UK, and they were being admitted the next day to have their nose surgery done, and they hadn't told the surgeon that they were trans. And then as soon as the surgeon found out they were trans, they were like, "No, we can't do this. You need to go back. You need to go and get 2 letters of referral. You need to go and have a psychological assessment. I can't do anything for you until you've had all this done."
That doesn't help at all.
So someone wants their nose to look prettier. You talked about it. You talked about rejuvenation. You talked about beautification, making yourself look younger, making yourself look prettier, making yourself look more feminine. You know, why does it matter whether you're cisgender or transgender when you want your nose to make you feel more confident in the world?
You can have your face tattooed without having a psychological assessment. Do you know, if you're 18 and older?
Okay. Don't try to find, you know, some sense, because there is nothing about it.
Is there an age limit?
No, actually, I mean, well, of course, performs itself, you know, we don't like to perform surgery in patients under 16-year-old, you know, for growing, and basically for growing, how do you say that in English? Just for
developing and their whole structure hasn't finished.
Because there are still some structures that may grow up, you know, in the face. So that's the main reason we prefer to wait up to the patient is 16, 17-year-old, you know. And this is something we are seeing much more frequent in Scandinavian countries. Now, when we have some consultation over there, like in Stockholm or, you know, in Copenhagen or Oslo, you know, we see a lot of very, very young patients coming with the family, you know, and they started a hormonal treatment when they were 10, 11 years old, you know, and that's amazing because, you know, hormones make a very strong effect, very, very powerful effect. You are starting or before starting puberty. So they grow up as a girl, and there are just, you know, you have to focus very much and say maybe just a slight detail here and there. That's amazing. That's great. On the other hand, we see a lot of patients, 60-year-old, you know, with no hormonal therapy at all, you know, a lot of beard shadow, you know, baldness, and then that's much more tricky, much more difficult to deal with, because if they didn't start with the hormonal treatment before, this is not magic. We feel very close to our patients, so we are kind of a growing family here. So it's funny because at the very beginning, my medical career, at the very beginning, I was very focused on oncological patients. I just wanted to operate, oncological patients.
On cancer patients.
Because I just wanted to help people, Now, of course, then I changed my mind. The last oncological patient was my mom. She's still alive, okay? But then I moved more towards the, working on facial deformities, so children, stuff like that, and then I keep on switching, and now at these states, for several years now, I'm operating, trans patients. I really feel, it's difficult to explain that in English. I'm sorry. It's a great pleasure, basically, because I really feel like a doctor. I really feel like a medical professional, because I feel I'm really helping people, Yeah. Some other colleagues, they say, okay, yeah, you're operating just noses on trans patient. Okay, you're not a real doctor. But now, honestly talking, I really feel I'm assisting and helping people to improve your quality of life, to make you happier, So I really feel like a doctor anyway,
I say this all the time, and I don't think people always get it, but it isn't always just about saving lives. It's about making lives. And when you give a trans person the confidence to be themselves and help them to get out into the world and integrate into society with confidence, that's creating a life.
Come on, you made my day. Come on.
Obviously, I feel it. So, that's the truth. And
Good words. Thank you so much.
I wanted to pick up on what you were saying there, Dr. Bellinga, because I haven't really considered it before, is what we're talking about is we haven't got somebody who is ill. We haven't got someone who's got a disease or a disorder, or we're not kind of saving their life in the traditional way that a doctor might heal a patient. But actually what we're doing by medicines and surgery is helping that life be much better. And I think, we've still got to consider that the medicines have all medicines have a certain element of risk. All surgical procedures have a certain element of risk. Yeah. And we balance that with the fact that this patient is not ill in any way, but we're making that patient's life happier, more content, easier to live.
Of course, as I said.
And the doctor, as a doctor, what a privilege to be able to help someone in that way.
This is not vanity. This is the most important thing to know here. This is about your life, about the patient's life, the quality of life, to improve the confidence, okay? And that helps quite a lot. So this is not aesthetic surgery, which is purely vanity, This is life-changing, basically. This is life-changing, for sure.
Yeah. And a 2-week holiday in Marbella. What could be better? I know there's loads
with no bruises and swelling. That would be better.
Yeah. I know we could talk for ages. There's lots and lots of questions that are going to come in about this, and I think what the best thing to do might be just if we could get some questions in and write the answers, and we can put them on our website so people can.
Great. Feel free to do that.
Yeah, I think that would be really good. But it's been really lovely talking to you today. Really lovely. And, facial feminization surgery isn't really a big thing over here. Everyone talks about top surgery for trans masculine people, or gender confirmation surgery down below. So it's really interesting to look at something which actually everyone looks at every day is your face,
correct.
So
the way
really
you present in society.
Yeah, really interesting. So if anyone in the UK had any questions to throw at the Marbella team, we'll get them answered and put them on our website.
It will be a great pleasure to do that, for sure.
Good. And it's been lovely talking to you today.
Same.
See you again.
Have a lovely day. Ciao. Cheers. Bye-bye.
It's been absolutely fantastic speaking with you, Raul. So, and thank you for giving us the time today.
And a real pleasure.
Right.
So whatever you may need, just here I am. All right? Cheers.
Bye-bye.
Cheers. Bye-bye.
Thank you. We hope you've enjoyed our programme. Do go ahead and subscribe if you haven't done so already. If you or anyone else are affected by any of the topics discussed in our podcast and you'd like to contact us, please drop us a line at doctor@gendergp.co.uk. We're very happy to accept ideas for future episodes and guests, or if there's something specific you'd like us to cover. You can also visit our website, www.gendergp.co.uk. You can follow us on social media @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in the show notes on our podcast page. Thanks for listening.